I've got a couple of my men in their 50s and they are ADHD. So I feel like maybe this comes a part of that personality that just think more is more. And so abuse testosterone. And then all you do is your luteinizing hormone goes into the toilet. And, you know, if you've got too much visceral sort of fat, you're going to get an increase in estradiol and increase your risk of cardiovascular disease. So testosterone, TRT, isn't a more is more, it's an optimization. You should be optimizing testosterone rather than replacing it. I always like that word.
Yeah.
A lot of hackers use. So you can't, and it's not something you can stuff around with because you will increase your risk of cardiovascular disease and things like that if you abuse it, which is, it used to happen more in the 80s and 90s. I think people now are understanding about optimization and things like that. But I have had a couple of my guys, and again, I'm not overseeing them, they're seen by a TRT specialist, but when I'm checking their stuff, I'm like, are you dosing correctly? And they were like, no. I'm like, your testosterone is like 5 times on the upper limit. And I'm like, you need to go back and check your luteinizing hormone, because the recovery from that, when you suppress your pituitary gland and your luteinizing hormone, is generally 12 months for your body to come back. So if you're a young guy wanting to have children, if your luteinizing hormone is in the toilet, you're not producing sperm. So the spermagenesis process has disappeared. So it's generally 12 months to get that back on track, maybe a bit faster.
I didn't realize it was that long. That's a long time.
It's a really long, you know, I'm giving you worst case scenario, but it's at least 6 months. Yeah. And so, you know, if you want to have children, you've got to, you know, and people are having children later, you know, women don't, you know, our windows open and close, you know, so just things to think about if you're a younger guy using TRT, or if you abuse it, or if you think there's more, there's some certain risks there you need to be aware of.